Welcome to the Read, Talk, Grow podcast, where we explore health topics through books. Our topic today is Munchausen by proxy, also called medical child abuse. Our book is The Mother Next Door: Medicine, Deception, and Munchausen by Proxy by Andrea Dunlop and Mike Weber. I'm your host, Dr. Denise Millstine. I'm an assistant professor of medicine at Mayo Clinic, where I practice women's health internal medicine and integrative medicine. I am so excited about my guest today. Andrea Dunlop is the author of 4 novels, including She Regrets Nothing and Women Are the Fiercest Creatures, and the host and creator of Nobody Should Believe Me, an award-winning investigative true crime podcast about Munchausen by proxy. Andrea is the founder of Munchausen Support, the nation's only nonprofit dedicated to supporting survivors and families affected by MBP, and a member of the American Professional Society on the Abuse of Children's MBP Committee, where she serves alongside the country's foremost experts. She lives in Seattle with her husband and 2 children. Andrea, welcome to the show.
Thank you so much. It's such a pleasure to be here.
Dr. Katie Johnson is an assistant professor of pediatrics at Mayo Clinic in Rochester, Minnesota, where she is a child abuse pediatrician at the Mayo Clinic Center for Safe and Healthy Children and Adolescents. Dr. Johnson has published articles in the peer-reviewed literature about medical child abuse and presented widely on the topic. In addition, she's collaborated to implement a new consult algorithm for cases of over-medicalization in children and adolescents at Mayo Clinic. Katie, welcome to the show.
Yes, thank you for having me.
The Mother Next Door is narrative nonfiction about the author's experience and exposure to Munchausen by proxy, focused on their work as an author and a criminal investigator, and taking readers through the topic by presenting 3 separate cases. The book, honestly, reads like a collection of horror stories that are so tragic, you'll struggle to believe they could possibly be real, and yet they are. So on Read Talk Grow, we discuss books that portray health topics in an effort to better understand these health experiences through story. In this case, we're going to talk about Munchausen by proxy, so our listeners can understand this complicated topic and even see that it might be more common than they could ever imagine. Andrea, this topic is personal. You've written several novels, and one, We Came Here to Forget, is actually about a fictional family that went through a catastrophe based on events your own family had faced. Will you tell readers about that and how the topic came to be the focus of so much of your work?
Yeah, absolutely. So I had a situation in my own family that took place, 14 years ago now. Things came to a head where my older sister Megan was investigated for medical child abuse of her older child, my nephew. And this situation really tore my family apart. And it was a really big and difficult event in my life. And when my family and I were going through it, we ended up becoming estranged from my sister and my nephew because of it, because we believed that the abuse was happening. And when we were going through this, I just felt like we were the only family on earth who'd ever experienced something like this, because this is not the kind of thing. Every life has big tragedies inevitably, but this is not the kind that people understand or know how to support you through, or even have ever heard of, or even maybe necessarily completely believe, right? I think you do face a lot of that just disbelief, denial, not because of anyone's bad intentions, but just because of the shock that these cases inspire. So as a novelist, there's always that adage of write the book that you wish existed, that you wish that you could have had. And I really went into that process just knowing that eventually I would write about it. And then when my husband and I started talking about starting a family, when I got pregnant with my daughter, with my older child, it all just sort of came rushing back. And I think a lot of people who are parents can probably relate to that when you become a parent yourself, any family stuff you have is going to come right back into the forefront. And it was in this moment in pop culture where we were having one of the waves. There have been several of the Gypsy Rose Blanchard story, which is usually the Munchausen by proxy story that people have heard of, if they've heard of it at all. And the show The Act on Hulu, which won a bunch of awards and was a huge hit for them. And I just felt like there's this sudden wave of awareness, but I don't know that people are getting it right. That was the impetus for the book. And then, I really thought I would write this novel and kind of get it off my chest. And there we go, have my personal catharsis from that creative project. And that's not what happened at all. So here I am. Here I am 6 years later. Yeah.
And we'll dive into the podcast and, of course, The Mother Next Door, which is, just to reiterate, nonfiction and based on real cases. But it's interesting that you used your fiction to sort out all that was going on inside you. You even write in the book, I always knew I would write about my sister eventually. Writers are prone to working out their traumas on the page. And I think that's something we've seen in other episodes too, where people are inspired by their own exposure to horrific events and can find fiction as a place to untangle that and actually even potentially come kind of more face to face with it. So, Katie, tell us your reaction to the book and also what it's like to be a pediatrician who focuses on child abuse.
It was a page turner for sure. And I actually split my time between reading the physical book and listening on Audible and found it kind of just as captivating, switching back and forth. I think because not only is it relatable to the work that I do every day, it was really gratifying to see that come out in a way that hopefully will be more accessible to more people to really understand what this is. Just like Andrea said, we see so much misunderstanding, not only among the lay public, but among medical professionals. We are undertrained on this, undertaught about it. And just in the past 2 weeks, instead of doing an article review for our weekly kind of journal club, our resident chose to read the book and give us kind of a book club review of it. And so it's already been really impactful in the education sphere.
Oh my gosh. Well, Denise, can I just react? That's so meaningful for me, Katie. You have no idea. And also, I'm sure you've probably gleaned this, but pediatricians and people who work in child abuse are absolutely my heroes. It is such important work. It's like harder than I think most people could ever endure for a day. And unfortunately, your treatment and a lot of the media has been horrific. And so I'm so glad to meet you, and thank you for reading my book, and thank you for sharing it with your colleagues. That really means a lot.
And likewise, we sing your praises in this field because we do face a lot of negative media, and we just try to get up there and tell the truth and look at things objectively. And so to have someone that has that gift for sharing with the world and with people who are going to pick this up in book form or in Audible, we really appreciate you being able to tell the story that we live medically.
Well, and Katie, will you tell our listeners what your day-to-day looks like? When do you get a patient referred to you? And then what do you do with that information? Just so they can understand, to Andrea's point, maybe they've heard some negative information about people who work in this space, and nobody's perfect, but I think everybody working in this space is well-intentioned and has a big heart and is trying to do the best with a difficult situation. But what does your day even look like?
For sure. It varies a little bit depending on where you practice and what the practice looks like. Child abuse pediatrics has been a board certified subspecialty with the American Board of Pediatrics for the past 10 or 15 years now. And across the country, we have programs medically based, like here at Mayo Clinic, we're a medically based children's advocacy center. And we take calls, consults 24/7 here. Some programs are daytime only call for any concern of maltreatment, whether it's physical abuse, sexual abuse, neglect, psychological maltreatment, or medical child abuse, as we call it. And the process for each type of maltreatment looks different, but it can be a medical provider calling us. We often sometimes work with child protection or law enforcement or even attorneys when they have questions. And in some way, we can serve as almost a medical translator if this is what all this means and this is what it would mean in your sphere. When it comes to physical abuse, we are recommending workups. We're doing consults in the hospital. We're seeing patients sometimes for foster care visits when they're entering into foster care. For sexual abuse at the Child Advocacy Center, we're observing child forensic interviews. We're offering testing and exams, although we're really trying to get the message out there that it's really more about the disclosure than the exam. The exam is almost always normal. And when it comes to medical child abuse, we often serve as the coordinator, communicator among the healthcare team, trying to make sure all the doctors and medical providers are talking to each other, understanding each other. We can help with kind of a detailed record review so we can tell, is this unnecessary and harmful or potentially harmful medical care at the instigation of a caretaker? Or is this something where maybe it's adolescent reporting most of their own symptoms, or it's a suboptimal interaction between the caregiver and the healthcare system, but it's not really that fabrication, exaggeration, or induction. So we can help with education and kind of sorting those concerns out.
Awesome. Thank you so much for giving us all that information. I'm hoping that at this point, the three of us can really hammer out some of these terms because I'm guessing many of our listeners are new to this topic, maybe don't even know it exists, or like you said, Andrea, only know from exposure to some more Hollywood presentations. So, maybe Katie, I'll go back to you because you just made a clarification. So we're talking about Munchausen by proxy, which is also called medical child abuse. So will you just define that as a topic?
Yes. Medical child abuse, the definition is unnecessary and harmful or potentially harmful medical care at the instigation of a caretaker. And it's kind of an umbrella term that does not take into consideration the motivation of the caretaker, but is an umbrella over things including Munchausen syndrome by proxy. And it also includes the very, very anxious caregiver that is not reassured by medical providers to the extent that they may exaggerate or seek second or third or fourth opinions and insist on testing that results in medical harm. So medical child abuse is more the umbrella term, and it includes Munchausen syndrome by proxy.
So, Andrea, Munchausen syndrome is different than Munchausen syndrome by proxy. Do you want to tease that out? And also, fictitious disorder and disorders of delusions, which you comment on in the book as being all very different things.
Yeah, correct. It's such a nice, relaxing experience to have Katie be the professional that just explained all of that. And I could just jump in with my 2 cents. This really gets to one of the most common misunderstandings about Munchausen by proxy abuse, because as Katie alluded to, medical child abuse and sort of over medicalization in that term can happen for different reasons, right? People can harm their children because they're anxious. That doesn't mean that that behavior shouldn't have an intervention, right? Because there's harm to the child. However, the intervention is going to look very different if it's a parent who's genuinely anxious or a parent who's suffering from delusions. That's usually pretty obvious. You know, if someone is in a full sort of postpartum psychosis kind of state or something along those lines, you're going to treat those situations very differently. And those are frankly a lot easier to deal with and more straightforward to deal with than Munchausen by proxy abuse, which involves deliberate deception. So it's really important for people to know that although there is a DSM diagnosis associated with this behavior, which is factitious disorder imposed on another, right? Or factitious disorder if someone's doing these behaviors to themselves, it's primarily a form of abuse, and we need to focus on the harm to the child, because people who engage in Munchausen by proxy abuse understand right from wrong. They are doing it knowingly. It is usually extremely planned and executed over a long period of time. There are cases where they're caught on videotape, you know, suffocating their child and then telling the doctor that that child had an episode or had a seizure after they were being suffocated, or they find medication in the mom's purse, or there's something like sort of a smoking gun. And I will say even those cases are still extremely complicated and difficult to hold perpetrators accountable. But that's also like not the majority of the cases. So usually it is really, you know, as Katie was talking about, in that medical record review, right? That's where you see that pattern of deliberate deception. So you see parents doctor shopping, which is different than seeking second opinions. And I'd love Katie to weigh in on that one. And like lying about test results or fabricating symptoms that don't match up with like pictures of the child that day or even video of the child that day. So it's like this very, very lengthy process of really going through all of the documentation and seeing if there is a pattern of deliberate deception, or okay, is this parent just in some kind of psychiatric distress or just very anxious. And so I think it's really important that people know that though there is this sort of mental illness question, it's not in the variety of mental illness that it makes people not culpable for a crime.
Well, I'm happy to talk about the second opinion versus doctor shopping. I hadn't really thought about that distinction until you mentioned it. The way I would make the distinction is everyone has a right to a second opinion, and we're completely fine with that. And when it becomes third opinion, a fourth opinion, and we're always latching on to the opinion that is escalating care, whether that is another referral or a lab test or a surgery or a medication or some sort of kind of fringe medical practice, that's when it becomes more of an intentional escalation in medical care, potentially medical harm.
All right, let's talk about the book. So there's 3 cases in the book, and Andrea, in your podcast, you've talked about many more cases, but the 3 cases in the book are Hope, Brittany, and Mary. Andrea, do you mind just giving a quick capsule for our listeners who haven't yet read the book to understand how these 3 cases are slightly different and where they overlap?
Yeah, absolutely. And part of what the book is really about is the career of my co-author, Detective Mike Weber, who's also an early collaborator on the show and really was the genesis for the podcast. I was watching him present with Sheriff Wayburn, who is the adoptive father of the victim in the second case we talk about, is Brittany's daughter. Watching them present about Brittany's case at the first APSAC conference that I went to, and APSAC is American Professional Society on the Abuse of Children. And I just thought, oh, this story is so moving. This is the kind of story that can sort of get people to recognize the impact that this really has. And so these were some of Mike Weber's first Munchausen by proxy cases, and he'd been a crimes against children detective for a long time. But then he sort of, became this expert because he just was willing to work on these cases, and a lot of people didn't want anything to do with them. Is kind of how he describes it. So yeah, so the 3 cases that we talk about in the book: Hope Ybarra, which was the first case that I covered on the show, and that was so impactful for me because that was the first time that my very first interview that I ever did for the podcast, when I really was so incredibly green. I was not a journalist coming into this. Was with Hope Ybarra's younger sister, Robin, and so that was my first chance to meet a family that had been through the same thing that my family had been through, and there was all of these parallels, with my sister's case. And so Hope Ybarra, it was this incredibly smart person who was very accomplished in her career, and she ended up perpetrating not only on her children, but having this lengthy cancer hoax that just really was sort of so extreme. And it's this sort of cinematic, thing of her jumping out of a plane when she was in remission. And so that's just kind of an incredible story. And that was Mike's very first case that he took all the way to charges and then a conviction. And so the second story we talk about is that one I kind of alluded to, which was the Wayburn family story and of Alyssa Wayburn and her mother, Brittany Phillips. And this story really illustrates for me, I think, because my own sister was very smart, and because, Hope Ybarra was really smart, and I sort of had this perception that these perpetrators are masterminds. Some of them are incredibly smart and present well and really get all of this access to power. The case we most recently covered on the show, this person worked for a high-profile rare disease organization for 13 years and really built up this entire career off of telling the story of her son. And so you do see some of them like that, but they're not all like that. Brittany certainly wasn't. And what that case really illustrated to me was actually that this abuse is very easy to pull off. We are so ill-equipped to deal with it that this is a form of abuse that is probably easier to get away with than almost anything else. And so that is obviously an alarming revelation. But so that was really interesting sort of study and contrast. And then, the Mary Welch story, this is a story of, that was the one that we included where the perpetrator was not brought to justice. That story to me just was a really interesting kind of zoom in on the legal system. And I didn't have any experience with or understanding really of the criminal justice system before I got into this work. And I think people don't realize how much comes down to just people making these individual choices. My sister was investigated a second time for her younger child, and there was a 2-year-long police investigation, and there was all this evidence. I've covered it on the show. And a prosecutor just decided not to charge. And that's just a decision they can make for all kinds of reasons, right? Sometimes it's because they really don't think, there really isn't evidence that the person did it. Sometimes it's just not something they want to pursue. It'll be too expensive. It's not politically expedient, all those things. So I think really like these cases all sort of personally resonated with me for one reason or another. We chose these 3 cases because we felt like they really illustrated kind of some key points about this abuse that we hope people will understand.
Hey listeners, we hope you're enjoying this episode of Read, Talk, Grow. If you find our discussions helpful and insightful, please take a moment to subscribe to and rate Read, Talk, Grow on your preferred podcast platform. And don't forget to tell your friends to listen. Your support will help us reach more readers and those eager to learn about health through books. As always, feel free to drop us a line at readtalkgrow@mayo.edu with suggestions for books, topics, or any comments. Thanks for listening. I really appreciated that each story had its own arc to it, and none of them were clean, but they were all not clean and straightforward in different ways, which was really brilliant how you put it together. Katie, I'm sure a lot of the story's components were components you recognized, they were familiar to you in your work. And I just wonder if you'll comment particularly about the medical details, if there are some common or frequently used components that you tend to see in medical child abuse?
Yes, we'll see involvement of the subspecialties neurology, gastroenterology. It can really span all subspecialties, but those in particular that rely on a reliable history from the caregiver. What surprised me about the Hope Ybarra case was the fabrication of cystic fibrosis, because the biggest question I had throughout that is, "Oh, how was that fake?" But it's revealed in the book kind of how that came about. But I thought that was really fascinating. And the other thing that really, I have to say, stood out to me when you were commenting on the legal system was the jury selection. I thought it was a really great example, though, of privilege, gendered assumptions, and things like that, and the variability that can happen in how these cases are carried out outside of the medical piece of it. I see this one view in the medical world, but I think the book was really nice at putting my eyes to kind of what happens on the other side, on the family side and on the legal side as well.
Well, and if I can just respond to that, I mean, Katie, I love that you said that, yeah, you're focused on the medical piece. And I think one of the things that drives me nuts, child abuse doctors really get presented as the people who are making all the decisions, right? You would think they were judge, jury, and executioner from reading these pieces. You hear these sort of like medical kidnapping and, oh, this doctor just separated this child. It's like, oh, there's so many more steps you have to go through for any of that to happen. And it has to go, through the child protection apparatus and to a judge who has to sign off.
There's also this picture often in the media of child abuse pediatricians are going to always see abuse. And what we know from the literature and experience is that about half the cases that come our way, we end up saying, yeah, that's pretty concerning. We should look into this more. And the other half, we end up saying, actually, that injury makes sense, or that's kind of a non-specific behavior. It doesn't mean necessarily that they've been abused. But we don't hear about those because they don't make it to court or to the media. And so that's one important thing I think to know about the practice of child abuse pediatrics. Another important thing that pertains to our work in medical child abuse cases is more often than not, we're serving as that coordinator, collaborator to make sure that we're getting a full picture from the whole medical team about what's going on. It's not this, doctor in the background that comes in and makes an independent assessment. It's organizing that information from the doctors that have been interacting face to face with the patient and family, usually for years.
Well, in one of the cases, it's so heartbreaking. One of the children actually has a procedure in their brain based on the report of the mother that is never verified by the neurosurgeon or the specialist who places the shunt in this child's brain. And I would imagine, Katie, that this is the type of situation where having somebody like you on board would confirm that there is documented, clear evidence before you take this step, as opposed to taking the history directly from the parent, which, as pediatricians, for so much of the child's life, you have to do because they're the ones who can verbalize. Can you just speak to if that's accurate or not?
Absolutely. And it makes me think of G tubes or gastrostomy tubes, because that's one of the most procedures that children will have in these cases. And so that's a tube that goes directly into the belly and can deliver nutrition. It's a surgery. Seattle Children's actually has this really great process and protocol by which they evaluate who objectively needs a G tube and who does not. And they found that that's actually pretty effective in making sure that we're not putting these in unnecessarily, because you'd be surprised how someone can get an unnecessary surgery with the right fabricated history.
And I always just wonder, is it the doctor moving too fast? And my heart really breaks for these doctors recognizing that this was a mistake they made because clearly they were trying to do something in the best interest of the child and being fed intentionally fed erroneous information to make those decisions. Well, Andrea, your title and the depictions in the book are really focused on mothers, which we have learned can be the most common perpetrators of medical child abuse, and also probably why it's hard for people to recognize that it's happening because nobody wants to think a mother would harm their child. Can you talk about how that role specifically has made an impact on Munchausen by proxy?
Yeah, absolutely. And this is something that I think about probably every day. So, yeah, what we know about perpetrators of this abuse is that over 96% of them are women. And, my take on the reason for that is not because it's something specifically in the female brain that makes people do this. It's because women are the people who have the opportunity, and as my colleague, Dr. Mark Feldman, always says, it's a crime of opportunity. I think it's really interesting to think about people who are pathological liars and who are manipulative and deceptive in this way. They lie indiscriminately about work, about personal relationships. You see a lot of affairs, you see a lot of just made up stories of trauma, right? Being assaulted or robbed or, sort of being the victim of these crimes that never happened. I mean, you see so much of that in this case. So it's this really, really pervasive pattern of deception. And men engage in these behaviors too. It just looks different, right? Men just tend to lie about different things. I think it's really heavily influenced by how we see motherhood, because it is this sort of perfect thing to hide behind, right? Because I think we have very messed up ways of looking at mother, which I think anyone who is a mother probably has experienced. On the one hand, we sort of really put motherhood on a pedestal, and on the other hand, we don't treat it like it's a worthwhile endeavor. We don't support it. We don't have any federally mandated paid maternity leave. We don't, we just really don't offer mothers much support at all, just sort of full stop, right? And so we have this very, sort of messed up relationship with motherhood. And I think that prevents us from seeing this abuse. And I think what I've really come to appreciate after years of reporting on these cases is, we sort of, a lot of times in the literature, it's identified as being a behavior that's meant to elicit attention and sympathy. And those things are certainly present. But I've also become really fascinated by how it's really about power, right? It's about having power over other people. It's about feeling powerful by pulling one over on doctors, who are far more educated maybe than you. It's about, having power in sort of your community, right? And getting media attention and sometimes about, getting a job in a powerful organization. It's really about power. And so I think, where do we give women access to power in our society over children, right? And that's kind of the only place we give women unquestioned power. So I really think that sort of more explains the gender dynamics than anything else. The reason I think motherhood makes a perfect screen is because it really violates something visceral to think about a mother harming their own child. Many of these perpetrators are, again, not all of them, but many of these perpetrators are very adept at looking like a caring parent, the most caring parent, right? The most heroic parent that would sacrifice everything, and they quit their job to be a caretaker, and they move out of state to be a caretaker, and they do all of these things for their child, and they get out their child and Make-A-Wish, a poor Make-A-Wish. It just ends up in every one of these cases, and they're doing all of this for their child. And so that's sort of how you see mothers. Then that's going to be hard to break through. And then, as Katie kind of alluded to, right, you have a rightful correction in sort of believing women about their own experiences, or not treating women full stop like they're not reliable narrators. And people can have a very strong reaction to that, right? And so, but of course, not all women are telling the truth. Women are humans, and humans have a full range of behavior, and women have the same full range of behavior and capable of evil behavior, unfortunately, as men. That's my feminism, I guess. Women can be just as evil as men.
When we talk about child neglect, if you think about what's expected of a single father, people are a lot quicker to call something neglect when it's a mother. So that's kind of this other gendered way that we look at sometimes people's ability to maltreat or neglect a child. Medical child abuse often contains medical neglect. There's an overutilization of inappropriate care. and an underutilization of appropriate care. And that underutilization is the neglect piece. For the older patients, the adolescents, a lot of times it's psychological or psychiatric support.
Yeah, that's a great point, Katie. And I think that's why, again, I was talking about at the beginning that we've sort of started using this term Munchausen by proxy abuse, because although the medical piece is often the piece that sort of comes to the fore and that is obviously the most likely to be life-threatening, you also see, other forms of abuse. It's psychological, it's intense psychological abuse, it's emotional abuse, it's educational abuse. They're often being pulled out of school for long periods of time. And we just sort of see these, now that we have sort of more survivors in the community that are sharing their stories, you often just hear things like they weren't taught basic hygiene, and they're really not being taught in any sense of the word how to take care of themselves, because the point is not for them to learn independence. Most of I have a 6-year-old and a 3-year-old, and my daughter is off and she's in first grade and sort of sending her out into the world. And you sort of see you really have to, the job of being a parent is to teach your kids to survive without you. And so when that's not the goal, it is this just profound abuse and neglect that actually is completely separate from the medical side. And we do see Munchausen by proxy abuse that doesn't lean so heavily on the medical side, that is really more about sort of pulling kids out of school and convincing them that they have something really wrong with them and that they'll never lead a normal life and they'll never be able to be independent, and attempting to take their rights away once they're adults. So that still very much fits in the spectrum of Munchausen by proxy abuse.
It occurs to me too that there's a lot of physical abuse because so many of these cases involve feeding and the withholding of food and hydration from these kids. And that is a very physical type of abuse as well. Katie, the book also highlights several different women who are perpetrators of this type of abuse. Is there a type of person that you see in this role?
Yes, as Andrea alluded, it's over 96% women, often mothers, and typically biological mothers. The demographic that we tend to see tends to have a few things in common, not always, but often. They tend to really enjoy the spotlight, whether that's attention on social media or a Caring Bridge or a GoFundMe, a Make-A-Wish, or they really like the attention of medical providers and seek that engagement. And they may have so much exposure in the medical field or some sort of medical background, whether they're a nurse or a nursing assistant, that they are very familiar with medical jargon and kind of very savvy in that way. And then, as I said, kind of regarding enjoying the spotlight, there's also tends to be a heavy activity online about a blog or a page that's completely dedicated to kind of their life. So those are some of the consistent features we see among specifically perpetrators of medical child abuse.
Thank you for that. Okay, I want to end on a brighter note because this is such a it's important topic, but it is a heavy and difficult topic. Can you both talk about what the future looks like and whether there is hope for Munchausen by proxy abuse?
I can tell you what I wish for this field, and we're starting to see some hospital systems. UCSD is one that published on this, having kind of organized systems for these consults, for tracking them, because it's currently not well reimbursed, the innumerable amount of hours that go into these chart reviews. And it's why Investigator Weber is one of the only people doing these investigations. And so I think if we can advocate for people to understand and see the prevalence of this type of abuse, and therefore recognize that it needs some funding, some time, some FTE. And I also hope for better coordination communication, not just within health systems, but between. And I think with medical records, we're starting to see some of that. And I hope even more so we'll be able to, communicate across health systems, because there's this dance that we do with HIPAA. We want to protect patient privacy. We also want to safeguard children and make sure that we're communicating about continuity of care. And so I hope we're seeing more in that direction.
Thank you.
I will say it can be hard, especially in this climate, to feel hopeful, right? We're up against some really big headwinds, and I don't think it does anybody good to pretend otherwise. We're in the middle in this country of a massive anti-science backlash. I think that is part of what's fueling this conspiracy of medical kidnapping, which, if people are so lucky to have never come across that term, is a conspiracy theory that doctors like Katie are just snatching children away from their parents and keeping them in the hospital just for reasons of fun and profit. And if it sounds like I'm being glib in that description, I'm not. That really is what it is. And, we saw this like massive case in Florida, and there's, several other court cases that are underway. So we're certainly up against a lot. But with that said, I will say the thing that gives me hope is that individually in each of these cases, even the ones that went really badly, I've seen people be very brave. I know when doctors encounter one of these people and they know that if they're the person that holds this person accountable, they're going to be the target of that person, that they're going to, could end up in a lawsuit. Like, I know doctors at this point know that that's the case, and you still see doctors standing up for those kids. And I will say that I believe that my niece is alive because of the doctor who intervened in her case. And that doctor was totally excoriated in the media. And I have talked to so many people and survivors who've been through cases who are alive because the doctor intervened, and who remembered for the rest of their life that that doctor thought their life was worth taking a risk on. And that never leaves people. So I guess that's kind of my hopeful thing to say, if, we have a lot of folks listening in the medical profession or, elsewhere, of just children are worth the risk. And I think there are a lot of people, I have to believe there are a lot of people that agree with that.
That is so beautifully said. And just to recognize that other brave people in this space are people like Dr. Katie Johnson, and then you, Andrea, and Mike, for having the podcast, Nobody Should Believe Me, and also for publishing this amazing book, which our listeners should go out and read, The Mother Next Door, Medicine, Deception, and Munchausen by Proxy. It's been my pleasure to talk with both of you today. Thank you so much.
Thank you so much, Denise.
Read, Talk, Grow is a product of the Women's Health Center at Mayo Clinic. This episode was made possible by the generous support of Ken Stevens. Our producer is Lisa Speckhard-Pask, and our recording engineer is Rick Andreessen. Visit our show notes to see the books discussed today and for links to other health education materials. Follow us on social media like Instagram and Facebook, or reach out directly to our email, readtalkgrow@mayo.edu, with suggestions for books or topic ideas. We'd love to hear from you. This podcast is for informational purposes only and is not designed to replace a physician's medical assessment and judgment. Information presented should not be relied on as medical advice. Please contact a healthcare professional for medical assistance if needed for questions pertaining to your own health. Keep reading, everyone.